Do unto others as you would have them do unto you. When I have conversations with people, I always tell them I am grateful that I was. I actually told myself that I would never go into concierge medicine. And that was because I wanted to take care of everybody. However, I was forced into actually stopping medicine for a while because of.
Hello, everyone. My name is Theo Harvey. I'm excited again for another podcast, Medical Success Secrets. And I'm super excited today because we have Dr. Kathyrn Tapper or Dr.Ktap. How are you doing today?
I am wonderful, Theo. I'm glad to be here to just dive into our conversation today. How are you?
I'm doing wonderful. Well, look, everyone, if you don't know Dr. Tapper, or affectionately known as Dr. Ktap, she is a concierge physician, wellness leadership, and lifestyle coach. She's a speaker and author that's super devoted to helping high-achieving women lead with authenticity, clarity, and purpose from the inside out. She is a board-certified family medicine physician who earned her medical degree from George Washington University and completed her residency at the Mayo Clinic in Jacksonville, Florida, where she also served as chief resident. Her medical training, personal health journey, and holistic philosophy uniquely positions her to bridge the gap between modern medicine and mindful living. A bold and transformative voice in the wellness space, Dr. Ktap brings a holistic approach that addresses the root causes of stress, burnout, and disconnection. She helps women eliminate the guesswork in their wellness journey, guide them to rise above the chaos, reconnect with themselves, and lead with greater ease, confidence, and alignment in every area of life. Thank you, Ktap, for these, your background and just your understanding. We like to get right into the questions here and just get a better sense of your journey. Can you talk a little bit about that from a patient and your provider experiences that you witnessed in medicine from both sides, right? How did your personal health story shape your view of what true healing looks like?
It's such a good question. And, when I have conversations with people, I always tell them I am grateful that I was a patient before becoming a physician, because my perspective of how to listen to patients, empathize with patients, and manage their care would be completely different if I wasn't a patient myself, because do unto others as you would have them do unto you, right? And so being a patient myself and how I would like to be treated, that is how I treat my patients.
Yeah, that's totally true. We have talked to a lot of physicians on this channel, and one of the things is we talk about, how do you build trust, right? And it's all about, like you said, just being transparent with your journey and experiences that builds that bond, understanding around your testimony. So talking about your background and how you got to where you were is really important. And ultimately that can lead to that final T, which is trust. We call it the triple T's. So,
I love that.
I think that is something that we're seeing a lot more physicians talk about. Can you delve a little bit on some interesting stories where maybe a patient was hesitant to kind of share something, and obviously, we'll be mindful of any, PHI, but just, some stories of why it was important for you to kind of share your journey that allowed that patient to kind of open up about their story.
I didn't used to share my journey that much with my patients. And that was because I just had to be comfortable within myself with what I was going through at the time. What I will say is listening to patients, being present, to add to the triple T's, triple TP, is really being present, because they know when you're not. And based on how the healthcare system is set up, it's for us to go, one patient after the other. And we succumb to that rat race because of how the system is set up. That's one of the reasons why I went into concierge medicine, because it allows me the time to really sit down with my patients, listen to what they have to say, and not just listening with my ears, but also listening with how I'm seeing them react to what I am saying and to what they're saying themselves. It gives a lot of information. But again, we bypass that when we don't have the time to do it. But even if we don't have that time, if we're able to listen just a little bit more, we will get more information from the patient, but also that trust factor that you've mentioned already. So an example, I had a patient that came in and he was very agitated, right? And to the point that I was concerned about my safety.
Oh,
But
wow.
yes, but doing what I just said was really listening to where that patient was coming from and understanding why that patient was upset and diving deeper into acknowledging the feelings that he was having at the time.
Mm-hmm.
The conversation went a completely different way, where he was able to relax, he was able to listen to what I had to say, and we were able to come up with a plan.
That's a great story and very powerful, especially when, men, are sometimes resistant to, going to see the doctor and opening up. Matter of fact, I'm in healthcare. I, talk to doctors all the time. But when I go see my own personal doctor, I bring my wife. Sometimes I don't even know what to bring up. And she's like, well, tell him about this, tell him about that. And sometimes I'm hesitant too. And so I think that's just unfortunate how men are kind of looking at healthcare, and that's unfortunate. But I'm glad you were able to get him to open up and, just share his journey and to kind of communicate exactly what was his issues. When you kind of think about, I would like to delve deeper into this concierge space, because I recently got a concierge doctor as well. I did find going through the traditional, primary care process to be too lengthy for my schedule. It was hard to get the doctor when I needed him. I had some health things journeys that I'm dealing with that I needed faster response, someone to be, in my corner. And I felt that 15-minute time was just not enough with him, on a computer the whole time. So I'm just curious, what was your journey to concierge medicine? We talked to a lot of medical practice owners, independent physician owners, independent physicians who have their own practices. Why did you go down this path, and where was your journey? Where were you working before, and then why choose this path, concierge medicine?
I actually told myself that I would never go into concierge medicine about maybe, let's say, 4 or 5 years ago, just generally speaking, and that was because I wanted to take care of everybody, right? Mm-hmm. That's why we go into medicine, to serve. And, coming from Jamaica and, our culture, and just wanting to help the underserved, everybody. However, I was forced into actually stopping medicine for a while because of my own health journey. Mm. So I was diagnosed with chronic end-stage renal disease, which is chronic kidney disease, at the age of 19. And that's how I became a patient before becoming a physician. So I was on dialysis and so forth. Long story short, got a transplant, wasn't successful, had to go back on dialysis. So when I had to go back on dialysis, that's when I had to take that pause from working in the clinical space. And it was at that time that I went into the coaching space, because it gave me more flexibility to build my own business and serve clients in a different way. So that's how I got into the coaching space. And then I was able to get another transplant, which was very successful. Praise the Lord. And I realized that I did want to go back into practice, but practicing in a way that suited both my health as well as the patients as well. So all of the different things that you mentioned as to why you wanted to have a concierge physician are some of the reasons that I went into it myself. Was I wanted to make sure that my patients had easy access to me, that I had the time to spend with them, get to the root cause of what is going on within their health, doing it from a holistic standpoint. Mm-hmm. So that's a version of my story.
Well, no, thank you for sharing that. And, definitely that is an awesome story about, just the whole transplant and able to kind of deal with that. And that's a powerful story to share. I'm sure, a lot of folks can resonate with that. I was just thinking about that. You had mentioned, I think here in the United States, healthcare just seems like, hey, this is something that, we need it and someone else is going to pay for it. But I think what was unique to you is because you had time to kind of go into that coaching space. I'm assuming that was outside of medicine. Is that correct? It was more around, coaching.
Yeah, great question. So initially it had started with helping people, not just women, but people in general, to not be defined by their diagnosis. So looking at their chronic disease and looking at ways that they can possibly reverse disease, for example,
Oh,
diabetes
awesome.
and so forth. A lot of people don't even know that you can reverse diabetes in certain circumstances. And then as I went along this coaching space, I realized that so many people, especially high achieving women, did not know how to manage stress. Like they were just burnt out, overwhelmed, feeling exhausted, that then can lead to chronic illness and disease if they don't take care of themselves. So that's how I shifted to really helping high achieving women to feel more calm, take the guesswork out of how to manage stress and burnout, feel more connected within themselves, leading from within in order to lead
Hmm.
other people. That is what I
Yeah.
help them with. Mhm.
So I love that, just understanding the coaching space, right? Kind of open up opportunities for you to deliver care in other areas. And so I think that is something that a lot of doctors don't understand. They just understand, providing care. There's some CPT codes and I meet these requirements and then basically get reimbursed for the work I do. But it's a whole new way of thinking about it. And because you came in from the coach standpoint, as well as, with your medicine background, it opened up the door. I just did an interview with a doctor out of Orlando, Florida. He does a lot of functional health, right? He came from the VA, did all that for years. And now he's kind of starting his own practice, but he's really focused on alternative medicine and how it can help patients. And so I think more doctors are being open to explore medicine that way and finding new ways to kind of treat patients. And obviously, what makes you guys different than perhaps the influencer on the internet is that you have the evidence-backed, studies and understanding of science and knowledge that brings gravitas to what you're saying, as opposed to influencer who is 20 years old, say, take these pills because they work. And so I think that's super powerful. I would love to kind of talk a little bit about chronic kidney disease a little bit, if you don't mind. We work with a lot of nephrologists and patients in dialysis. And one of the things that we found is that a lot of patients in that with that disease state have uncontrollable hypertension, right? High blood pressure. And so, one of the things that we help with is delivering blood pressure cuffs remotely, so patients can monitor more succinctly and get that information back to the doctor so they can make adjustments near real time for that patient population. Maybe talk about, from the science understanding, of why hypertension is so prevalent in folks that have chronic kidney disease and why remote blood pressure monitoring can't help, ease that.
Absolutely. First of all, I love that you have that service in really monitoring patients from anywhere. That is just a game changer in patients' health. So, kudos to you and your team for doing that, especially as we're talking about hypertension here today. Our kidneys have many different functions, one of which is fluid control, which then affects our blood pressure. So when our kidney function is not optimized, it's depleted, then it significantly affects how blood pressure is controlled within our bodies. So you have to be very mindful, of course, about what you're eating, which affects your weight and so forth, right? So when you have chronic kidney disease and you're on dialysis, that's a whole other story, because when you go on dialysis, one of the things that they do is to remove that excess fluid that has been building up within your body because of the malfunction of your kidneys, right? And another thing is, of course, removal of toxins as well. So when you go to the dialysis clinic, that is the main thing that they're doing with the machines. So throughout the process of dialysis, which usually takes about 4 hours for most people, you're going to have this flux of blood pressure up and down depending on that individual. So during the dialysis sessions, it's very important to be monitoring the blood pressure. It's usually about every 15 or so minutes. So having the opportunity to continue that monitoring of blood pressure after dialysis and between when dialysis has ended and when you need to go back the next time is also crucial, to get all of that information for that individual to say, okay, how is this patient responding to what they're eating or not having dialysis over a certain period of time. It's very important. I didn't even know that it even existed. So it's really great that your company is providing that. I hope that that clarified.
No, absolutely. Well said. And obviously, there are new programs to provide dialysis at home. And then combine
Correct.
that with a blood pressure, you can kind of
Correct.
make adjustments near real time in how they're delivering dialysis. So,
Correct.
technology is evolving to kind of
Yes.
help patients live a more fulfilling life, right? And not have to be stuck to a machine for, hours at a time at some center far away from home. And so, I think that's the goal with these remote tools, right, to kind of help patients to live a more fuller life without having to feel like all their life is spent, in a hospital or in a healthcare clinic. So,
Mm.
so those are kind of where the future we see healthcare going. And
Mm.
I think one of the things that's also important, so obviously we're talking about, technology creating more wellness for the patient populations. But let's talk a little bit about the holistic person, right? Spirituality, you talked about stress. Recently, well, not recently, but last couple of years, Center for Medicare and Medicaid Services is starting to reimburse for behavioral health, right? So integrating mental health services inside the primary care visit. What are your thoughts about this holistic understanding of the human person to help them get the help that they need beyond just healthcare?
I think this is transformative because we cannot separate our mental health from our physical health and wellness. The way how I practice, I look at the 8 dimensions of wellness, which includes your physical health, mental, your spiritual health, your relational health, your financial, your environmental health, and so on. All of that is interconnected. So, for example, if you are stressed about your finances, right, you cannot not be stressed when you go to work if you're stressed about it at home. It doesn't make any sense. It sounds very weird for me to even say it. It might sound even weirder to even hear it, right? So we have to understand that all the different aspects of our health and wellness are interconnected. So for Medicare and Medicaid services to realize that more of that mental health needs to be addressed within the clinical space is a game changer. And we're in the month of May, which is Mental Health Awareness Month, right? And so I think it's going to be very, very transformative for sure. And we are lacking mental health professionals in the United States, probably worldwide. And we definitely need more help where that is concerned, especially after the COVID pandemic.
Yeah, totally makes sense. And so when you kind of look at that, you talked about the 8 dimensions. What are those 8 dimensions? Do you mind me asking?
Yes. Okay. So you have physical health and wellness, right? Mental, spiritual, relational, occupational, financial, intellectual, and environmental.
Wow. Yeah, that covers the gambit of the human experience.
Yes.
And you'll be surprised, you're right. If there's one area, if I'm dealing with a health issue that affects my work or that affects I'm agitated more, so that affects my relationship with my family, or maybe I can't focus on other, I can't, my finances are down because I don't feel like going to work as much. And so every piece string affects the other. And I think sometimes, I can speak for myself, but I know a lot of high performing folks, they could try to compartmentalize and
We
say, hey,
try.
this is the area that I need to focus in on, but you don't know slowly that it's creeping in and messing up. You don't know how good you could be if you do address those other areas of your life, to your point. And so
Absolutely.
I think that
Absolutely.
is so key. Well, just curious, what made you get involved in social media to share your experiences, right? I talk to practices all the time. We had Dr. Isong, who was a cardiologist, who got into it because his patients, he wanted to create a FAQ to kind of help his patients because they kept asking the same questions all the time. Or Dr. Durag, who used raps to kind of help patients remember, from an educational standpoint around the health benefits. So what kind of got you engaged into social media and going down this path?
Yes, I would say the same thing as the two people you just mentioned a while ago. It's the awareness of the population, right? So a lot of people don't even realize that they can look at their health and wellness differently. For example, using the 8 dimensions of wellness. So for me to spread that awareness so that they can make the connections within their lives to say, oh my goodness, I have anxiety because I can't sleep. And I can't sleep because I'm having relational issues, right? Just making those connections are so important so that they can identify it and then seek the help they need so that they can grow through it, not just overcome, but grow through it, right? Challenges come up in our lives, whatever that might be, physical, mental, any of those aspects of our lives. They come up in our lives for us to grow through them. So it's all about how we are approaching those challenges that come up. Notice I didn't say problems or issues. Very keen with the words that I use, but challenges. So we can rise to the occasion, whether it's by ourselves or with help, so that we can elevate how we see ourselves and how we show up in the world.
Mm-hmm. And what if you were talking to a colleague and say, hey, how do I get started on social media? Or, I'm hesitant to do so. What advice do you give them? We talk to medical professionals all the time via this podcast. What would you tell them? What steps that guided you to kind of get started?
So first of all, I had a coach at the time that I started social media. So just getting accountability is helpful because anybody who's starting off, you're going to be very afraid. That is normal. You're going to be very uncomfortable. Why? Because it's something different that you're doing. So that is very understandable. The most important thing when you're starting is to show up with authenticity. You don't have to be perfect with how you're showing up. You have a vision, you have a mission. Remember what that is, and just be your authentic self when you show up, and people will relate to the authenticity.
Yeah, I love that. Definitely. I would add to that too, have a purpose behind what you're doing so that you don't get caught up in the day to day. As someone who's on social media as well, comments, people say whatever. You got to ignore some of that. That's negative, but you realize I'm doing this for a purpose. I'm trying to help folks. And so if you stay focused on that, there's a saying, focus on the gain, not the gap. So a lot of people want to focus on the lack or the issues. And of course, wherever you focus on will grow. And so the more issues you focus on, the bigger the challenge becomes in your mind. But if you focus on the gain, hey, I did a video today. I did another video today. Oh, look, I got a positive comment. You're focused on the positive aspect of the growth that you're achieving on social media, then you're more willing to want to do more of it and share your experience.
I'm so happy that you said that. One of the things that allowed me to show up was remembering that it's really not about me. As you mentioned, it's really the mission. Okay, why am I doing this in the first place? And stay focused on that. That will get you through. You're serving other people in a different way outside of the clinic or outside of the hospital. You're serving on a bigger platform and you're showing up for someone that may not be able to show up for themselves in that moment.
Absolutely. Well, great. Well, Dr. Tapper, this has been great. Where can people find you, or do you have any upcoming events or books that you're launching here in the next couple of weeks?
Yes, so people can find me on Instagram at Dr.Ktap, Dr.Ktap, or LinkedIn and Facebook at Kathyrn Tapper. Very, very easy. And one of the things that I have coming up this year is my book called You Are Greater Than Your Diagnosis. So it takes people through 10 steps that I've learned that can help them to not identify themselves with whatever diagnosis that they might have, or maybe it's a family member that they might have as well. So yeah, I'm excited about that coming up.
And what was the name of the book again? You are
greater than your diagnosis.
You are greater than your diagnosis. So please, everyone, check that out when it comes out. And more importantly, it shows you as a journey as a doctor who was also a patient. I think we need more of those stories out there so patients feel more connected to the healthcare profession. So that's hugely important. Well, everyone, look, we're going to finish today. I hope you enjoyed this conversation. I immensely did. This is the kind of conversations we have here. Our goal is to kind of give you exposure and understanding of what's happening out there in healthcare as we're rapidly changing with technology and new ways of care. So definitely go check us out on the next podcast. Leave a comment if you like what we're talking about here, and looking forward to help you drive to the new normal of healthcare. Thank you. Hey, I hope you enjoyed that. Look, we have more content that can really help you accelerate your practice this year. We have tons of content that can cover all the different topics we discussed earlier. If you want to hear more, click to the right or to the left and you'll get more content to understand how to best grow your practice.